In our Health Watch this morning, local drugstores, some of which are becoming mini doctor's offices in disguise. Most national chains are opening their own walk-in clinics, and these walk-in clinics, it turns out, are booming. In 2006, there were just 250 of them nationwide, but by the end of 2007, more than 800. And they're projected to be more than 5,000 by the end of the decade. So why are they so popular, and perhaps most importantly, are they safe? Dr. Ezekiel Emanuel is an oncologist and health policy expert. He's here to talk about the rise of the retail clinic. And they do seem to be popular, Doctor. I think the numbers are 34% of Americans say they would use one, 16% say they have. What about them is so attractive?
Well, I think it's convenience, convenience, convenience. I think it's easy for people to get in the local pharmacy, much easier than making an appointment with your doctor, having to go to maybe an office across town. And I think that's the big issue. And then sometimes there's also a money difference.
Okay, so it's easy, it may be a little bit more inexpensive, but is it safe? Is it smart?
Well, it's a little too early for us to tell how safe they are, but there is a big incentive for them to run, to work on the safe side and to follow very strict protocols for most things.
So before we know if they're safe, when would you then recommend that we maybe turn to the walk-in clinic instead of trying to get an appointment with your doctor?
Well, I think they're only really useful for acute things, sore throats, ear infections. I need a flu vaccine. I don't want to go all the way to my doctor. For serious issues like this brain tumor behind you, you obviously wouldn't do it. Chronic conditions, diabetes or asthma, probably not a good idea.
And also the cost, as we mentioned, some of them can be inexpensive, but not always. Should you check with your insurance first?
Well, increasingly, the public is demanding that insurance cover them. In general, they have been cheaper than doctors' offices and physicians' offices, and that's, I think, driving some of this issue. It's cheaper to get a flu vaccine than to make a whole appointment with your doctor.
Absolutely. So that's one reason people are going a lot is just in turn to. I visited one, actually. I was having a cold. I didn't feel so hot. I had a little baby. Didn't want to get him sick, and I couldn't believe the list of vaccines you could get there.
Right. You walk in, you get the shot, you walk out, and it's 5 minutes as opposed to trekking across town, waiting in the doctor's office. And I think, again, that just goes to the fact that the public wants this to be very simple.
Wants it to be simple, but as you said, we don't know yet how safe they are. So if you are in fact going to use one of these walk-in clinics, I know you have some tips on making sure that we stay safe. The first one being make sure you're in contact really with your doctor.
Right. You shouldn't never hide this from your doctor. Tell your doctor what you did. Tell them that you got checked up, you got a strep throat test, or you got a vaccine, so your doctor has a full record of your health. It's a bad idea to have your doctor not know some very important aspect of your health. And
just to reinforce, too, you say only use this for acute illnesses.
Right. This is about short, simple stuff. It's not about complicated health problems. And if you at all suspect it's a complicated health problem, or you discover at the clinic that it might be complicated, you really have to go into the mainstream system, the doctor, the hospital.
Which speaks to your third point, that clinics don't replace that experience at the doctor's
Right, this
office.
is certainly not a replacement for the doctor.
Is there any concern among the medical community, yourself a doctor, that people will start to think this and maybe they won't go to the doctor as often?
Well, there is a concern that it'll increase the fragmentation, that you'll get a little bit here, a little bit there, and no one will have a whole picture of your health, and something could fall through the cracks. I think that's the real problem.
So something to keep in mind. Dr. Ezekiel Emanuel, great to have you here with us today.
Thank you very much.
And of course, to find out more about when you need to see a doctor, when a clinic may be enough for you, just log on to our partner in health coverage, WebMD.com. Search for Call the Doctor.